Today, I'll show you how to make a diagnostic wax-up for anterior teeth. When dealing with multiple interventions on anterior teeth, the smile design is often changed, and the planning may not always meet the patient's expectations. To make anterior aesthetic rehabilitations more predictable, diagnostic wax-up can be a great idea. It allows to conduct a restorative trial, known as a mock-up. In this video, I'll focus mainly on the planning of closing multiple diastemas. In my opinion, performing the diagnostic wax-up ourselves enhances our manual skills and provides more predictable restorations. So, let's go through today's step-by-step. You can choose to use a manual wax dropper and an alcohol lamp or an electric wax dropper. If you choose the manual dropper, practice to achieve the proper wax plasticity for sculpting. Follow these exercises to do it. First, create wax balls with the dropper. See how it's not easy to achieve the right consistency. Usually, the wax becomes too liquid and flows without forming a ball. Second, create wax drops with the dropper. Third, make curved shapes with the dropper. This is undoubtedly one of my biggest challenges. And finally, create a vertical structure, like a wax column. If you can successfully create all these forms, you're ready to perform the wax-up using manual instruments. If you have an electric dropper, calibrate it to wax reaches the appropriate plasticity. If the plasticized wax completely drips down by electric dropper tip, it means it's too liquid for sculpting. The ideal consistency of the wax in the electric dropper is when it flows along the length of the tip but stays in place at the dropper's end. Calibrate the dropper temperature until it reaches this consistency. Now, let's move on to sculpting. For diastema closure, it's important that the restorations are adequately distributed in the spaces between the teeth. Therefore, the first step I usually take is to fill these spaces with wax. Note that I'm filling only the spaces without applying wax on the vestibular or palatal surfaces. Start on one side. In this case, I began on the right side of the mouth. After completing the wax application, I check if the smile curvature is correct. If everything is okay, I repeat this procedure on the left side of the mouth. Check if the tooth positions in the arch are correct. The wax should be applied following the patient's dental arch shape. The wax doesn't always turn out the way we want it. Therefore, I use the number 8 Lecron carver to remove the wax excess. Put it vertically, parallel to the vestibular surface, and make scraping movements to remove wax prominences and leave the sculpture smooth. Repeat it on palatal side of arch. Now, the arch looks much more uniform and rounded. Look at this smile line. I notice it's too flat for a young person. As I've clinically determined that I can slightly increase the incisal edges, I'll make a small addition only to the incisal edges of the central incisors. So, they will dominate and give a more youthful appearance to the smile. But be cautious, only increase the incisal edge if the patient allows this addition after facial analysis. Otherwise, the patient's free functional space can be invaded, and the restoration may fracture, or the patient may start having speech issues, such as a lisp with the tongue between the teeth. Therefore, a good plan is required to increase the size of patient's teeth. Here, I increased only 0.75 millimeters on each tooth. After applying the wax, always plane it using a sharp Lecron carver. Now that I've outlined the smile line and the curvature of the teeth in the arch, it's time to distribute the restoration among the teeth. To determine how much wax will be allocated to each tooth, I start by marking the patient's midline. I use the midlabial frenum as a reference and mark the midline on the wax between the two central incisors. Next, I estimate the width of the central incisor, which is about 80% of its length, and measure it using a compass tips. I mark the distals of each central incisor to have the final width of each tooth. I repeat the same process with the lateral incisors and canines. Note that this patient has a large diastema between the canine and premolar on both sides. Therefore, the mesials of the premolars will also need restoration. Transfer these buccal markings to the palatal surface of the sculpture. Before proceeding with refining the sculpture, I'll add a little wax to the top of canines. This is because the anatomy of a healthy canine presents a pseudocusp, which is important to perform mandibular lateral excursions and protect the anterior restorations from wear. Do not add more than you did to the central incisors, or it will become too prominent. The addition I made is completely irregular, so once again, I'll use the Lecron carver to regularize the wax. I also take this opportunity to sculpt the slopes of the canine incisal edge. Remember that the canine does not have a straight buccal face. A central edge separates the two inclinations of this face. Now, let's refine the sculpture. Carve the cervical emergence profile. Emergence profile is how the tooth emerges from the gums. Note that the sculpture is straight, making the tooth very square. There will likely be excesses if I create the composite resin in this way, consequently, it could inflame the gums. Therefore, use the most delicate tip of the Lecron carver to create the curvature of the proximal region, as if the wax were emerging from the gums and following the root extension of the tooth. Do it for all teeth, both on the vestibular and palatal surfaces. Now, sculpt the incisal embrasures, which are the triangular-shaped openings between the incisal edges of the anterior teeth. Between the central incisors, the embrasures are symmetrical, more discrete, and less open. So, apply the fine-tip Lecron carver lightly. Between the central and lateral incisors, the embrasures are not symmetrical and are more open. On the distal side of the central, the opening has a more rounded and broad curvature, while on the mesial side of the lateral, the opening is smaller, and the curvature is less broad. Between the laterals and canines, the embrasures are not symmetrical and are even more opened. In the distal of the lateral, the opening has a smooth and broad curvature. On the mesial of the canine, the opening is more angled due to the incisal edge's anatomy, which has a pronounced slope. I have completed the primary shape of each tooth, but you may notice that something is still missing. Looking from this incisal view, we can see the teeth lack delineation. Some details are missing, such as the edges that create the areas of light and shadow on the tooth. Therefore, I'll add a little bit of wax in this region to positionate the vestibular edges. The canine has 3 edges because there's a central edge that divides the vestibular surface into 2 inclined areas. In an ideal situation, on the palatal side, we should sculpt the marginal ridges, which are kind of edges on the palatal side. However, to avoid interfering with the patient's occlusion, instead of adding, I'll remove all the wax from the palatal region. Now, add wax between the sculpted edges on the teeth. Do not apply wax in the cervical region to avoid restoration over contouring. Finish by planing and uniformizing the wax on the vestibular side of the teeth. Remove the rough excess to avoid over-contouring the teeth. Refine the proximal edges. Finish by creating macro texture on the teeth. Sculpt the developmental grooves. The canine appears to have a very prominent tip. To remove this impression and reinforce the canine incisal edge, add a little bit of wax to the palatal surface. Place the wax as a small ball in the center of the cusp on the palatal surface. Note that the space between the canine and lateral incisor has decreased slightly. Make final adjustments if necessary. And that's the final wax-up carving. So, create the matrix and perform the restorative trial for diagnosis and preliminary evaluation for aesthetic rehabilitation. Please subscribe to this channel to stay updated, like this video, and activate notifications. I hope you enjoyed it, and see you next time.